So on the day of surgery, patients are gonna wake up like normal. Make sure you set your alarm clock in advance. And most important thing from our standpoint is please don't eat or drink anything. The reason that's important is if you have any fluid or food in your stomach and you're in the operating room under anesthesia, that food can actually come back up and go into the lungs. And that can be incredibly dangerous. It can even be fatal. So it's super important to make sure you don't eat or drink anything on the day of surgery. The only thing you will usually take would be something like a blood pressure medication. Usually we've already advised that with just a really small sip of only water. Once we get to the hospital, we usually get you there to the hospital a minimum of an hour and a half to 2 hours before surgery. And there's a reason for that. It is a process once you get there. You've got to go into registration. During registration, they're going to go through your intake, make sure all the insurances were approved, so that way we don't have any surprises there. We've got to get you back into a room, changed into a gown, you're going to get an IV, and then they're going to review your chart. We need to make sure that all the labs that needed to be done prior to surgery are still valid. Sometimes some of those labs are a little bit older or something was concerning, or sometimes not all the labs actually made it to the hospital. It's not a huge deal. We can still repeat those labs once you get there, but again, don't let that freak you out. Once we get the labs reevaluated, I'm going to see you before surgery. We're going to discuss everything. Again, make sure everybody's happy. We can still cancel at this point. Nobody ever has to feel like because we're there, if anything's unexpected, there's always a chance to bail out. Anesthesiologist is going to have a long and pretty important conversation about all the risks and benefits of the anesthesia, again, to make sure there's not anything surprising. And then the last thing is the waiting game. Everybody's always nervous. That's okay. It's completely normal. I tell patients, look, the only small surgery is when somebody else is having. It's a big deal to have a surgery, and we appreciate that. But try not to get too anxious. Schedules, I'm going to take as much time as I need with each patient in the OR, just someone like I'm going to take with you. So don't let, if you get there a little earlier than you had wished and it took a little longer, that just means we needed a little more time with somebody else. So be patient with us if that happens, but for the most part, we get folks back, we do the surgery, and then after that, it's all about the healing, and that's the most important part from my standpoint. I think my job's relatively easy. The patient's job after they wake up, that's the hard part, and that's why everybody needs to be prepared.